difference is.
So each school had their own cap. So you'd recognize where someone graduated from the cap that they wore.
And their pin.
And their pin, yeah.
At first it was just a white dress uniform, white nylons, white shoes, and a white cap with a black stripe. And then we graduated to white pantsuits. I have always loved my cap. I loved my cap the day I walked into nurses training, and we had our cap, and we used to have a little emblem on it that showed our school. And then 2 years later, graduated and got the black stripe on graduation. It got in the way a lot, pulling curtains between patients, and I worked in emergency for a lot of years, and the cap did get in the way, but I still loved my cap.
At the time that I graduated, the predominant hair was long, so most of the nurses had to put their hair up into a bun of some sort. It stopped the cap from shifting from side to side, so that was the only bonus about that.
I got my capping picture and I just looked like a real dope. The color white gives you an impression of sterility, cleanliness, and we did get them messed up a little bit at times, but I remember if it was really bad, like a lot of blood, or it would be offensive to a patient, or a smell, we would have to go and get a scrub dress from the OR or something like that. And then these were a few things I was able to gather.
Thank God we advanced, eh?
Yeah, imagine how
those
long...
were not disposable. Those you had to then take
these
down
are glass.
to your
These are
room
and
supply room and wash them and re-auto.
Bringing the uniform back to where it was before, I think you probably would meet up with some resistance. They're quite comfortable probably in their pantsuits and the different colors.
During a code was a difficult time when you wear your cap because everything's moving far too quickly. So during my first code, I had my cap on and I was doing my procedural cardiac compressions, and my cap went to the side of my face. That one of the physicians, Dr. John Minardi, pulled my cap off my head and told me not to wear my cap again. And the patient survived, and we looked at the aspect of, wow, these caps can get in the way sometimes. I love to bring them back, especially during Nurses Week. It's a trend that we've created on day surgery, Michelle and I, and it seems that more nurses get involved each year. I think there's about 10 of us now that wear our white uniforms and our caps with the black bands, and we get such a positive feedback from our patients. Well, the thing is, we needed white bobby pins, and if it wasn't for Donna, who I go to every year to her supply for her white caps, her white bobby pins, and so that nurses in day surgery could keep on this tradition and memory of wearing white to remind people where we originated. And it's something to be proud of. At least we are proud.
Hi, my name is Sue Wass. I work at Windsor Regional Hospital, Med Campus. All nurses from Windsor Regional Hospital could participate in what's called White Wednesday. I'd ask you to come on board and join us in wearing your whites every Wednesday. It would be a great way to show your support.